Wet Cough, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Wet Cough, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of wet cough. Chapter 1. 1. Is coughing natural? Yes, coughing is a natural reflex of defense of the body. 2. What is a productive cough? A productive cough is a cough that produces mucus. 3. A mucus is also called a phlegm. 4. A phlegm can also be called a sputum. 5. Is sputum saliva? No, sputum is not saliva. 6. Is mucus bad? No, mucus is not bad. 7. What is the function of mucus? Mucus helps to keep the airways moist and also protects the lungs from irritants. 8. How does coughing help the body? Coughing helps to expel the excessive mucus in the lungs. 9. What can happen when too much mucus is in the lungs? When there is too much mucus in the lungs, breathing becomes difficult. 10. What are the causes of wet cough? Wet cough can be caused by infections from bacteria or viruses. Chapter 2. 1. What happens to the production of mucus during an infection? There is an increase in mucus production during an infection. 2. What can cause the body to overproduce mucus? Pneumonia, asthma, cystic fibrosis, bronchitis, COPD, etc. can cause the body to overproduce mucus. 3. What is bronchitis? Bronchitis is the inflammation of the bronchi. 4. What is the most common cause of chronic bronchitis? Smoking is the most common cause of chronic bronchitis. 5. What is pneumonia? Pneumonia is an infection of the lung. 6. Can pneumonia be caused by bacteria? Yes, pneumonia can be caused by bacteria. 7. Can pneumonia be caused by a virus? Yes, pneumonia can be caused by a virus. 8. Can pneumonia be caused by fungi? Yes, pneumonia can be caused by fungi. 9. What is COPD? COPD, chronic obstructive pulmonary disease, is a chronic inflammation of the lungs that obstructs the airways. 10. What is cystic fibrosis? Cystic fibrosis is a genetic disease that damages the lungs and other parts of the body. Chapter 3. 1. What are the signs and symptoms of wet cough? Some signs and symptoms of wet cough may include fatigue, weight loss, and fever. 2. Can a dry cough occur after a wet cough? Yes, a dry cough can occur after a wet cough. 3. Can a cough heal on its own? Yes, sometimes a cough can heal on its own. 4. Is mucus with a foul smell a sign and symptom of an infection? Yes, mucus with a foul smell is a sign and symptom of an infection. 5. Should a doctor be contacted if there is blood in cough? Yes, a doctor should be contacted if there is blood in cough. 6. What is the diagnosis of wet cough? The diagnosis of wet cough are physical exams, lung function tests, chest x-rays, blood test, sputum analysis, arterial blood gas, pulse oximetry, etc. 7. What is pulse oximetry? Pulse oximetry is a test that measures oxygen saturation level in the blood. 8. What do the treatments for wet cough depend on? Treatments for wet cough depends on the cause of the wet cough. 9. What are some common treatments of wet cough? Some common treatments of wet cough are bronchodilators, medications for allergies, humidifier, antibiotics, expectorants, mucolytics, etc. 10. What are bronchodilators? Bronchodilators are medications that relax and dilate the muscles of the lungs, which makes breathing easier. Chapter 4. 1. What are antibiotics? Antibiotics are medications that fight bacterial infections. 2. What are expectorants? Expectorants are medications that facilitate the expulsion of mucus. 3. What are mucolytics? Mucolytics are medications that make mucus thin and easier to expel. 4. Does hydration help for wet cough? Yes, hydration helps for wet cough. 5. How does hydration help for wet cough? Being well hydrated helps to fluidify the mucus and reduces the buildup of mucus. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding wet cough.